Hey, welcome to House Healthcare. It is Tuesday, May 2nd, and we have Sarah Clark with us this afternoon for a pretty short period of time. So what we want to do is just touch on our original budget memo and what is still in the budget, and then what is out that we might have to go back to appropriations on. I'm going to turn it over to Sarah.
Great, thank you very much. So I think from a base funding perspective, the Senate did not reduce any appropriations that were in the House passed budget from a base perspective. There were some adjustments made to the one-time appropriations, and we'll walk through those.
So that means all of our Medicaid reimbursement funding is still in.
That's correct. That is correct. And actually, they were able to provide some additional funding in some key areas. So for example, if you recall, we did a 4% rate increase to designated and specialized service agencies, traumatic brain injury providers, and substance use providers as well. The Senate added an additional 1% on top of the 4% that was in the budget, bringing it to a total of a 5% rate increase.
Great.
Related, and I'll touch on it now, though it's in a language section, they had a slightly different language construct as it relates to the rate increase for the designated and specialized service agencies, in that it took of the total 5% rate increase, it parsed it as a 3% base increase across the board to DAs and SSAs. And then it took the remaining 2% and indicated to the Agency of Human Services that that 2% shall be used to provide payment equity across the provider agencies. So that's a little bit different than the construct that you had.
And can you tell us what section that new language is in?
Yes, that is in section E300.1. And we'll talk about the language in a little bit, but I figured that was a good opportunity to let you know about that.
Yep. So all the Medicaid, so EMS, primary care, specialty care, FQHCs,
Yep.
home health, everything stayed in. So that's really great news.
Yep. There was a technical adjustment. Funding is the same for the Vermont Free and Referral Clinics. I believe that was a recommendation from this committee. The funding is still in the budget. We just moved it out of the public health appropriation and into the Department of Health admin and support appropriation, but the funding is still there.
Great.
And then I think the other item that you will be interested in is, if you recall, there was $1.85 million included for a base increase to recovery centers, including Jenna's Promise.
Yep, that was good.
Okay, thank you. That is still in there, I'll say that, but it does treat Jenna's Promise a little bit differently. So with their own $100,000 one.
It is still there.
And then, are you interested in the House budget created 9 quality and assurance positions
Yes.
that was in the House version of the budget? There were 9 of them created in the Department of Disabilities, Aging, and Independent Living.
No, we don't.
Okay. Because now those 9, instead of all being at Dale, the House budget actually keeps 5 at Dale.
Okay.
But it moves 3 to the Secretary's office and 1 to the Department of Mental Health. I think with the idea that these positions will be looking at quality and performance at a broad spectrum of facilities, not just Dale facilities. And so I think you'll be interested in that. And so that was a recommendation coming from the Agency of Human Services, and the Senate accommodated that request.
Can you tell us what section? That's language, I take it, right?
It's actually in a couple of different budgetary sections. It's going to be in B300, B314, and then I can't remember, Dale admin, B329.
Sarah, do you know if those positions are related to a CMS requirement?
They are, yes. Yep.
Meaning we have to have them?
Yes.
Okay.
Yep. And then adult day, okay. So I think that's actually it for base budget adjustments.
Yep. But the dental rate increase,
Oh, yes.
that's in there, right?
That is in there. Dental rate is in there. There's a piece of language that's a little bit different. Sorry about that. Thank you. That you recommended. And why don't we take the opportunity to talk about that? So the funding is still the same. And if you recall, your budget increased the cap on dental services from $1,000 to $1,500 per year.
That's still in there, right?
So it has changed it slightly, but I think it is related to the language that you had. I think you had kind of wanted to assess what would be the impact of eliminating the cap on dental services. So the language that the Senate included in their budget will allow the DVHA, the Department of Vermont Health Access, they may set the maximum of coverage for dental services on a calendar year basis based on the availability of funds. So I think, and then they'll provide a report to the legislature letting them know if they adjusted that cap upwards. So I think the idea was, we're appropriating an amount. And if DVHA has the ability to increase the cap beyond $1,500, they'll have the flexibility to do that. And Ameren is the one that actually helped us draft that language. I should.
Hi.
I am in section E307.1.
Page 50 of the.
Correct. Thank you.
Well, I'm in this budget, so I'm just.
Oh, yeah, that's kind of different page numbers.
Yeah.
I will say on that, Mike Christian, the healthcare advocate, has reached out to me and has talked to Diane about making the suggestion that we accept the Senate language, but we also add back in an analysis of the impact that we had wanted. And so since we had all voted on that, I'm going to talk to Diane about trying to get that back in.
Yep. So if maybe we can turn to one-time appropriations, see if that makes sense. And I'm going to just look at my list and call out the ones that I think you'll be most interested in. And I think DMH, is that?
Yes, that's
okay, great. So I'll say the one change that they made related to DMH and the Soteria House and the Pathways program, it's $985,000 was on the one-time list in the House version of the budget. The Senate has moved that to the contingent appropriations in the cash fund construct. What that means is that at the end of the year, when the year closes out, if revenues come in higher than what was anticipated within the budget, there is a list of contingent appropriations that will be funded with that excess revenue. And so the Soteria House project is on that. The reason it's now in the cash fund construct is because it's considered a capital project, because it's for the renovation of the building. So.
And is that list that's in the budget, in that contingency, in a list of priority order?
It is.
And can you tell us where Soteria House is?
Yes, I can. And it's, if you're interested, it's in B1105, Part D. So, which is on page 16 and 17 if you have the bigger document, B1105 Part D. And Soteria House is, there are 5 projects currently on the contingent list, and the Soteria House is number 5. Yep.
So if there is not, try to use the language right, if there's not a surplus, they don't get the money.
Correct.
And if there's not enough of a surplus,
Yeah.
the surplus.
Yeah, exactly. So if there's not enough of a surplus, that's probably a more accurate way to put it. If there's not enough of a surplus, then Soteria won't receive the funding needed to move forward with what we supported policy-wise. Okay.
So that's something for us to talk about.
Yeah.
Yeah, and at the time that the Senate put together this construct, we very closely monitor revenues as we come closer to the end of the year. And it was believed at that time, it's roughly around $20 million of projects that are on the contingent list. It was believed at the time that Soteria House would be in the money, if you will, that there would be funding to support it. And so I'll just caution you that that does continue to evolve and that we're closely watching it, and imagine it'll be a topic for the conference committee.
Okay. Ryan and then Marie.
I had another question. It's right there. Hold on. Why don't you go and I'll find
Okay.
it. I'll write it down when it comes in my head again.
When in the fiscal year would Soteria House feel, when might they feel comfortable in going ahead and spending money? When would they know?
So it would probably, I mean, the state really officially closes out its books the first 2 weeks of July. And so that's when we would know for sure if it was in the money. I think regardless, the Department of Mental Health will have to enter into an agreement with them for the funds. So I wouldn't expect they would want to move forward until they had a grant or contract, whatever is appropriate in hand for this arrangement.
So it would be July this year?
Yes, July of 2023. 24 now,
Yes.
right? We're in 23.
So they could know pretty soonish.
Yes, yeah, I would say in July or August, it usually takes departments and agencies a little bit of time to enter into agreements after, when the fiscal year starts, so it would be in the July or August timeframe, I would expect.
I did remember the question, so, or like the complex questions. So just to clarify that we're talking about a budget surplus from fiscal year 2022. 2023.
Yes.
That would be applied to the
Yes.
budget we passed for 2024.
Correct.
And then, and then the other piece is if it's on a contingency list and the money isn't there in July, but the money is there in January, is that something that could be addressed through budget adjustment?
Yes,
If they still
yes.
If they still have access to what the building they were gonna.
Right. That's true. And that leads me to my final question, which is, and you may not be able to answer this. I mean, maybe someone from the committee, the legislator is supposed to answer it, but you might be able to, so I'll ask. And if you don't know the answer, at least it's out there. That when money committees are looking at the impact and considering the cost of funding something, do they also look at the cost of not doing it to the state in the long term? For example, like if we don't fund Soteria's renovation, what impact will that have on, what ripples will that have on the mental health system over time of not investing now when there's an opportunity? Has the committee taken testimony on that? Or
So that's us, really. So that's the policy piece that we should be advocating and being able to provide that information.
So we can do that. Okay.
Yes.
All right.
So let's just finish going through this and
Okay.
then we'll have a discussion.
Great. Thanks.
Okay.
Okay, the other big one that the Senate added that was not in the House budget is the $9,225,000 for the new youth inpatient facility. Potentially in the area in partnership with the hospital there.
So if you remember, that's the one that we put forth in the budget adjustment, was taken out and then was not put in the House. I think it was actually maybe I don't remember, but so it's back in the Senate.
Yes, it's in the Senate.
So that's another one we'll have to talk about.
And I should be clear, I'm only now talking about things that have changed from your version. So if I don't mention it, it means it's still in there.
Actually, I mentioned it at one point when you're ready. You haven't mentioned it yet, but I just don't want you to leave before I get it.
No, that sounds good. Okay, so the next one, the blueprint pilot, that if you recall, it impacts the secretary's office, DEVA, and the health department. The House budget essentially funded the first year of a 2-year pilot. The Senate has provided funding for both years of the pilot.
And remember, our committee put forth priority for both years. So basically the Senate is doing what we had originally put forth.
Correct. Recovery housing.
That's not us.
It's not you. Okay, thank you.
Why is that being cut too?
The one-time funding, there was $1 million in the House version that's not included in the Senate version, but there is some language that's asking the health department to assess it. The Senate thought it was a bigger issue than just that one-time appropriation. So there's some language asking the health department to kind of assess the lay of the land with recovery housing.
So I think you've hit on the ones that I know. Can I ask you a couple of questions and then Leslie will let you ask? The 988 prevention line.
Yes. Oh, thank you.
I don't know where that is, but it was 275,200.
So I think that was in the governor recommend,
Yes.
if I recall, and so that has not been adjusted.
Okay.
It wasn't adjusted by the House or the Senate.
Okay. And then 100,000 for EMS study is still in there, right?
It's still in there, though I think the language has changed.
That was my question.
Yeah.
So if I could.
Yeah.
So we went into the VDH budget And I didn't understand what that implications of that meant. And maybe you don't know that, and
So I think the Department of Health does manage the relationship with the EMS provider, so I think that's why it was put there. I think the House version of the language, and you should definitely do the side by side because that was one of the key pieces in your document. Your language, I think, created a study committee, whereas the Senate is tasking the commissioner of the Health Department to provide a report to the General Assembly on emergency medical services in Vermont. And so it's a different approach.
there was representation by the legislature in that, whereas I don't know that that's included in that.
It's not, so.
So that's a concern.
Most of our, so most of our stuff is gone. We can look at the language and yes, it's a concern of mine too. My biggest concern is what are they using the $100,000 for?
And who's
In
involved, yeah.
our language, it was to hire a consultant.
Yeah.
So
Yeah, I want to make sure EMS was represented.
we'll come back to that, yeah.
So that was my, thank you, that was my concern.
And then, there was, so the governor's recommend, had the discontinuation of a drug coverage with pharmacy benefit, B307, it was like in a lot of places. We recommended that it not be taken out. Do you know where that landed?
So I think the House budget agreed with the governor, if you will.
Okay, they ended up taking it out.
Yeah, they did.
Okay.
But they did restore the DIVA cost sharing reduction.
500.
Yes, and that has stayed with the House position. I think was this committee's recommendation as well.
I mean, for those.
Yeah, so the cost sharing was the $500,000 where they were going to eliminate the program. And DIVA was basically like, it would take us too much time right now to do that. And it would take away from redeterminations. And it was $500,000. So we said,
For
fine.
those 3 drugs.
That's the other one. So that's the drug coverage one. And that's the one that Sarah's saying the House version had agreed with the governor, not with us.
Not with us, okay. Look at that too, or?
So yeah, we're going to do a very quick conversation.
Yeah. On the $100,000 for the EMS study, I think the language is very similar between the House and the Senate version, and that it's providing support for that study.
I think so.
No?
Can you tell me what section that is?
Yeah, if you go to B 1100, this is where you have to dig through your bill. B 1100 N5, which
15.
it's on page 6 of the link that I sent earlier today.
Of the 59
Yeah.
document?
Yes,
Oh, page 6.
yes. $100,000 to the Department of Health to support the Regional Emergency Medical Services Coordination Study.
Am I not?
Let me pull up this Senate, the House version. Different.
Yeah, I must be looking at the wrong.
On the 97-page document, that section starts on page 16. The B
Is it, so
1105.
when you say the 97-page document, which document are you looking at? What's the name?
Get to the first page.
Oh, Senate.
The annotated, I think it's
Yeah.
the Senate annotated.
In what page?
Page 6 in I'm gonna just pull up the House budget quickly.
All it says is 100,000, wait a minute, never mind. What are we talking about?
$100,000 general fund to the Department of Health to support the Regional Emergency Medical Services Coordination Study.
that's all it says.
It's similar length, that, I think it's
No, we-
basically the same as on the
So we had,
budget, but okay, I'm sorry. I
Okay.
was talking about the one-time appropriation for the 100,000.
oh, yes.
Yes,
And then
you're
there's
right.
the language about the study.
The study that is very different. So it's the
Yes.
study committee versus the health department. So you
That's right.
definitely, that is very different.
Okay,
My apologies.
that's okay. All right, so we'll come back to that.
I think tobacco and substance use disorder prevention and, okay? Sorry, guys.
No, and I mean, I feel bad because we would love to hear about it, but we
Yep.
just don't have time to hear about it.
I think, and I could be
that's
wrong,
it.
but I think that's it. And then if you want, in the Senate annotated, we could walk through some of the language.
That'd be great.
So I flagged it, what's different, and then I also provided to you a document of struck language, so you can see what's been struck.
Okay.
The green is what's been added.
Correct. Green has been what's been added. And the first section, which is on page 39, which is section E124.2, which are prevention programs, which I think this committee, no, okay.
No, so what we would be concerned is the healthcare claims tax sunset extension.
Still in there.
Okay, and then the hospital system transformation planning, just so everyone knows, that's been moved to H206. So it's out of the budget and it's going to 206, right?
Oh, goody.
It's,
Hopefully going to 206, if not, it'll be in this bill.
okay, there is language related to that.
The hospital-
Go to page 59 of the annotated, which is section E345.
Okay,
There's language, hospital system transformation planning pilot projects, which just is asking the Green Mountain Care Board to provide an update to the Health Reform Oversight Committee regarding the financial status of hospitals.
right, so let's,
So I think there's probably a bigger conversation
Yes.
happening in the other bill.
Yes.
Is some related language in here.
yes. So this is in here, but they took our language out, which if you remember, wasn't really our language. It was Senator Lyons and I language that I told you all about the money we were going to move from Green Mountain Care Board to AHS to start 4 hospitals doing transformation.
Yeah.
That is no longer in the budget. It's being put in H206. Okay. And then EMS study we'll talk about.
Yep. I think there is a new piece of language that you may be interested in,
Okay.
which is in E125.1, which is a review of workforce incentives, loans, and scholarship programs.
Yeah.
That does impact some programs that have been established in the last couple of years, focused on both the healthcare and human services workforce. And the language is basically asking Ledge Council in the Joint Fiscal Office, working with the Agency of Human Services to kind of come up with an inventory of existing state programs, a summary of the programs themselves and the associated funding, and any recommendations for streamlining or restructuring the existing programs.
Which I think is great. That's good. Okay. And then,
Most of things already. So,
yeah, so we need to talk about EMS and then the increase to the dental cap. I think are the 2 biggest things for us. And then,
there is language in E300.2 related to the Blueprint Hub and Spoke pilot, which is asking AHS to identify alternative funding sources once the 2-year pilot funding
okay,
been exhausted. And I think we've captured everything else.
okay.
Free clinics get mentioned.
There's no language, that was just a technical update, but it is still included, the funding is still there.
Yeah. Yeah, so I will have to say, I think for our purposes as a committee of what we put forth, 99.9% of it is still in the process, which is really great. Let's talk about the couple things that are not. So Sarah, thank you.
Thank you.
I know you have to go, which is fine, so we'll just switch to a committee discussion. But appreciate your help, unless you have a question for Sarah.
Okay, great, thank you all so much.
Oh, yeah.
Like always, you as well, I hope.
Leslie?
I'm interested in our relationship to the joint conference committee. How do we communicate with them? Because all these things now go to them, and we have 3 representatives. I'm just wondering how it works.
So we are now going to talk about the things that are different, and we may, as a committee, we can say to Representative Blumey, who's in the room, that yes, these are still really important to us, or no, we agree with what the Senate put forth. And then really, it is the House Appropriations Conference, these who bring it forward, and we win some and we lose some at the end of the day. That help?
We'll see. I
mean, I don't, so what?
Maybe, we'll see.
See what the score is.
Yeah, I'm not really sure.
Okay, so does everyone agree that we would like them to add back in the dental cap language, which is basically them doing, I mean, I'll read you the language that Mike Fisher put forth. No, it's not. I think that's not it. This is what. Yeah. So it says, so basically the Senate version is saying, yes, go up to $1,500 per year. And they may adjust the maximum pursuant to the process outlined in subdivision B of this subdivision 2 and may approve expenditures in excess of that amount. Then this is new language. The department may set the maximum for coverage of diagnostic, restorative, and endo something procedures in excess of the amount set forth in subdivision A for a calendar year based on the department's annual assessment of available funds. I mean, it's basically just what Sarah said, right? They can look at it every year. Then what Mike Fisher would like us to propose is the following. The department shall report to the committees of jurisdiction by January 15th, 2025, an analysis of the impact of Medicaid dental provider rate increases on the participation of dental providers in the Medicaid program, the geographic and network adequacy of dental providers for the Medicaid population, utilization of emergency dental services due to allowable exceptional medical circumstances, and predictions on cost of increasing or eliminating the dental cap. So basically, we're giving, this big increase to dental, and how is it really helping?
I like that, actually.
He didn't put access in his language. I'm not sure access is related to it. I mean, we just read it. It went by fast, sorry. But I was wondering about how it would affect access.
Let's talk about participation of dental providers.
But I'm talking about access for patients.
Removing the cap is what allows that, right?
Maybe. But I'm just asking them to think about it, that's all.
Yeah, and the geographic and network adequacy of dental providers for the Medicaid population.
I think that covers it.
I think we get there.
Okay.
I have an agreement that we should add that language back in.
Okay. So can I send this to you? Are you going to put together a document for us? Is that how this works? Could you? Okay. I'm going to send that to you. It's all right there, so you just have to. All right, and then another big piece is the EMS study. And
That's at the
so,
bottom that Jen wrote, the memo from Jen. It's all listed out.
yes, so none of this language is in the Senate version. So if you go to the document that's posted, which was our original budget letter to House Appropriation, we put in that whole EMS study. So there's a lot here. And I will say some of it's there. So it talks about what it's set to do, decrease costs, improve coordination. So the what it's supposed to do is still there, but the who is involved is not there. So
In the study?
yeah. So basically, the Senate is saying, Department of Health, you need to do this. Look at these things, and they're similar to what we had put in, and then send in a report.
And it doesn't specifically state representation from EMS providers.
No.
That's a big.
It asks for, let me pull it up. It says, whatever the normal language is that we say when it's like interested stakeholders or something. Let me find it, because I'm going to use the neat little thing that Bobby taught me. Go to actually, you know where it is, Amber.
Which document are you looking at?
I'm looking at the Senate annotated one.
This EMS is the last letters of.
I know, that's right, I'm getting it.
So it was on page 6.
Okay, it's on page, so if you're looking in the Senate annotated, which is the 97-page document, it's on page 51 in green. So it says the Commissioner of Health shall design and conduct a stakeholder engagement process that ensures input and representation from all types of emergency medical service providers serving Vermonters. So it does say that, as well as hospital and health systems, public safety, and municipal government. The report shall identify issues and provide recommendations for legislative consideration that will sustain and improve the provision of EMS for Vermonters. This may include issues related to cost of service and existing funding models, issues related to coordination across agencies, and issues related to EMS district structure and authority, including considerations of recommendations on the number and configuration of districts and their powers, duties, and authority. So it is very similar, except it doesn't list out all of the people, but it does say stakeholder engagement process.
But it doesn't include legislators, which the original bill did. I'm not saying yes or no, but I'm just saying that is a difference.
I'm okay with it as long as the EMS representation is there.
EMS representation is there, as well as hospital, health systems, public safety, and municipal government. I'm not sure legislators help.
Yeah, I'm just saying it's different, and the original bill did include that.
Yeah.
I imagine for a purpose, because a legislator sitting in the room, I'm just thinking out loud, I've never participated, so I have no idea, can bring together everything into a bill. So rather than have advocates having all those people write the bill, it can have input from someone who might be a sponsor.
Okay. So that's a decision point. And then the other decision point is in our language,
Cost sharing.
I thought we actually asked for a consultant. Sorry, I'm just reading this.
Oh, it's in H. Including hiring a consultant.
So, right, so the reason for the $100,000 in our original was because we wanted a consultant. I think we should put that back in. Personally.
If we don't add the consultant back in, how does that change this?
BDH gets the $100,000 and they do everything versus working with a consultant.
And what's the difference between a consultant and VDH?
Outside.
They don't want the staff to
More
do it.
neutral, more neutral sort of.
Well, I mean, I'm not saying VDH is bad in doing it, but it's, I think we've heard testimony, what I've taken away from the testimony that we've heard from the EMS, everyone involved, is that it's extremely complicated. And there are so many different municipalities, so many different types of nonprofit organizations. My original desire for having a consultant do it is they can get maybe into those levels more than VDH on their own.
I think that's why
Yeah.
we originally did the consultant now. Yeah.
I agree with both you in that they are likely not to have the resources to do what we're actually wanting them to do, and it should be a consultant.
Yeah.
I don't know if it factors in, but the consultant will be free of political pressure from the governor's office.
Yeah.
If, for whatever reason, not that it shouldn't be involved in this, but.
Anyone not interested in putting the consultant, I mean, the money's already in the budget. Anyone not interested in putting the consultant in?
You're saying put money in.
Money's already there.
Yeah.
We're just saying that it should be allocated for a consultant to help
Rather
with,
than the Department of Health.
rather than just the Department of Health.
Yeah.
So it's the appropriation, which is the very last part of the, and maybe that's what their Senate language is getting to, but it didn't specifically say consultant, so.
Can I ask a question? Do we have any clue why they made that change? Or is that, I mean, that's what I'm wondering is sort of, is it better? Yeah, what's better? I mean, I want a good outcome. So how do we think about the best outcome? And I don't know that answer without testimony. Clearly, we're not doing that. I get it. So it's a little hard to know how to come down on this.
So at some point, we have to either accept what they did based on what they did, or we as a people sitting at this policy table say what we want because we think it's going to be the best outcome.
And that doesn't mean we're going to get a consultant
No.
and put it back.
It doesn't. No, it doesn't.
Lori, we're on page 51, correct?
Yeah.
End of the page. And I apologize. There's a lot of stuff.
I know.
here,
Yep,
and
I got it.
I'm lost a little bit, but so this is different than what we put in?
Yes,
We put in to have a contractor?
yes,
Okay, so we want to revert back to that, is
yes.
what you're saying.
So we're saying accept their language that describes the process,
And at the end,
but add back in that we want a consultant.
gotcha, okay, all right, yeah.
Yeah,
Yeah.
okay. Then we have the blueprint for 2 years. House appropriations did it for 1, Senate did it for 2. I'm assuming we're still good supporting the 2. Okay, get my little notes too from appropriations. And then we have, so now the 9.2 million for the Bennington facility for youth, inpatient, co-occurring psychiatric medical needs is back in. DMH is saying they still want it and it's still needed. We unfortunately aren't having DMH in until next week. But do we still support that?
Now, it's back in to study it, correct?
No, the $9.2 million is in to do it if the feasibility study and everything moves forward.
Okay, and so we going to, is this only for Bennington?
Yes. So it's the same proposal
Okay, same.
that we had put forward in the BAA.
But I thought the feasibility study was going to determine whether that was something they did want to do.
Yes, and the initial outcome of the feasibility study is yes, they do.
Oh, really?
Yes.
That was my next
Yes.
question. Okay.
Yes.
Is that-
So it's not, no, I'm sorry, I have to email it to you.
Okay.
It's not ready for, final release yet, but yes, it is something they want to do. And it is something that the Senate put back in.
I'm not wild about it down there, but that's just me.
I don't think anyone's wild about it down there.
They're the only ones that stepped up, don't
They're
forget.
the only ones stepping up to do it.
Now that we know that they are saying they want to do it, I'm okay with keeping it.
One of the potential decision points, and kind of need to talk to Diane about this and get some more information from Department of Mental Health. So if we say yes, we think it's still something we should move forward with. Do they need the whole 9 million in this budget? Or could we fund what they need until the BAA?
Put the rest towards the.
At this point, they're not gonna spend that money now.
Well, I don't know about that, but put the rest towards something. But Art?
Right, I was just gonna say, I can't believe they'll spend all that money now.
Right.
I mean, this is kind of late in the game unless they've got plans drawn, designed.
And I think the big outstanding
I mean-
issue is they're gonna need a CRN.
Yeah,
And so depending on how long that takes,
Yeah.
that could put us
this is
into,
a fiscal year 25 project.
I mean, I think so, I do think they need some now.
Yeah,
But do they need all 9 million?
Wait,
I thought that when DMH came here way back, and, you know, this was like 6 years ago with BAA, or however long ago that was. They had kind of indicated that this is more like a renovation
Yes,
of an existing, and that I mean, the reason they needed it so quickly in the BAA was they wanted to be ready, hit, you know, shovels in the ground, even though it's already existing. Like in June, they thought. And
Right,
they
all-
thought it could be done.
well, they thought it
Within this
could be
year.
done this year, but that was back in January.
Well, yeah, but they still had to wait for the feasibility study, which they just gotten. So, I mean, I was under the impression that they were,
No, they do have to do
that it could have
construction.
gotten. But it will be done in fiscal year 24, which is what this budget is.
Yes, but is it before the BAA? Right, so do we say you can have half now and half later? Or do we say, no, we want to make sure this opens, and so we want all of it on the table now?
And how much will they need for the CON process, and how long is that gonna take?
The Senate put it in. We supported it the first time around, we should support it now,
The whole
the
amount?
whole amount.
I agree, and I think,
Why not?
yeah, if we're in, we should be in, and God knows the intricacies of financing something like that, and with supply chain issues, I think if they need it all, we should give it to them now rather than potentially hold things up along the way.
I remember your very impassioned speech on the floor.
My very impassioned speech.
Yes.
Which one?
It's true. On this?
On this.
So I'm sending you the feasibility study. So other thoughts on that? The
Roll call.
Go ahead.
It had their budget or
Yes.
draft in it that showed their spending plan.
If they get an expedited CON, they could move fast. If they don't, it could be longer. Not sure, you know, I kind of agree with Alyssa. We supported it before, why, you know, and the feasibility study is showing they can do it. Why would we not support it now?
I just want to be a dissenting voice. I don't think we should do this. I really don't think we should. Just one guy, only because of location. Location, and then we heard from the Brattleboro retreat, and I'm still trying to get that in my head here, how that fits in.
Well, remember, the reason for this is the co-occurring medical diagnosis where the person needs to be in a hospital. Brattleboro Retreat does not offer that, nor can they.
However, when they were here.
And they came back to us and said they cannot offer that.
Yeah, all right.
Yeah.
Still, this facility belongs from here north, in my opinion. That's one guy's advice.
I don't think anyone's disagreeing with you on that.
I know. But I think if we went back to these facilities and put this out again, I bet we get a taker, but maybe. Yeah, I know.
Anyone else before we take this, Russell?
Supporting it. Oh, we're gonna start.
Comments? All right, all those in favor of doing the 9 million in this budget? All right. Got that?
I got that.
Okay. All right, Soteria House. So this is on the contingency list. The contingency list, they're the 5th on the list. And do you have that up by chance? I think the 4 before it, one was the St. Albans Garage.
Where are we in the bill?
So this is on the one-time section, on the link that Sarah sent. So it lists all the one-time money. And then at the very bottom, it has a cash fund for capital and essential investments. And so this is, if at the end of the year, we have money, these 5 projects may be funded in the order that they're listed. So the order is the St. Albans Garage Replacement, Missing Middle Rental Housing, Rural Industrial Development Grant, Rail Trail Grants, and Soterra House.
Page 17 are at the top.
The very last.
17
Yeah.
at the top.
No,
Thank you.
Are you shaking your head?
Yes.
Because I am too. Yeah, like this is just, It's a no-brainer to me, like,
which is,
we should fund this. This, I mean, the fact that it's on my contingency list is just, it's so sad. Like, this is community-based health. This is what everybody knows we should be doing.
And this is the only thing on this list that actually saves money as opposed to, I mean, I'm sure these are all lovely other things.
Well, rail trails are good for our mental health too, but this is.
because everyone goes on the green trail.
Yeah.
Or the walk trail.
Take one on the roof.
Lori has her own trail.
I have my own trail, I go all the way, none of you are.
Come on, we're asking
So,
so
here's the
much.
question, where do we get the $1 million from?
Well. I have a
To raise taxes on the healthiest people.
From our pot of money, where do we get the $1 million from?
5%.
Let appropriations figure that out.
The Ways and Means would have to figure that out.
The 5%.
No, we have to go with a suggestion. We have to go with a suggestion.
Back to 4.
How were we gonna do it before?
So are we trying to find $1 million to
We had
move
it
from
as
one place to
one-time
another?
money, we just had it as.
I have an idea without reading the language, just thought throw it out there. What if we suggest, you know, how there's that cash contingency thing? That if there's money that wasn't spent in 2022 on workforce development for healthcare, because there probably won't be, based on what we've heard, that it could come from that.
Well, I think that's ARPA money, I'm not sure we can.
All right, well, I was throwing it out there. You can,
That's
it
a
can be
good
shot
idea.
down. Yeah, I was just trying to think where there's money that went up.
We don't really need to find the $1 million, but I think we need to understand that if we go back to approach and say, we really want this is still a number one priority, which I'm all for doing. I mean, they're gonna have to find $1 million from somewhere else.
And was it a number one in our rankings?
It was,
It wasn't a high priority, yeah.
I think everything was a high priority item.
Yeah.
Melanie.
How do they get prioritized on that 5-item list? How was that? Like,
A high priority.
Just,
cash fund capital, like how is that prioritized?
that's the Senate.
That they just, okay.
Yeah.
So in the Senate bill, there is the workforce area, which Brian, it's interesting you picked up on that too. There is a healthcare workforce area that pulls from general fund this year, and there are a couple things. One is $1 million from the general fund to the Department of Health to provide training for EMS personnel. I'm guessing that's like Narcan training or something.
No, we put that in.
Yeah, that's ours.
We put that in.
Is that our $1 million for the
Yes.
contractor?
No, that $1 million is for training for EMS providers that they ask for. We're not
Okay, that's
taking
a
it.
separate point. I'll
We're not
keep it
taking that.
separate. But I have-
The contractor's
I-
$100,000.
Yeah, thank you for trying.
There's something else I'm gonna say about that later.
Okay.
We have 4 minutes.
The 3 million,
Hold on, Daisy. Go ahead, Tiff.
There are so many things at play in this budget, and there are so many kind of structural differences and priority differences. I don't think you need to worry about where it comes
Okay.
from. Right this minute, you might, and any advice you have is great, but I think that knowing from you that it's a real priority and that you want it to go back into one time is what our committee would best.
Okay, so we're not gonna worry about finding the money, Daisy, but if you have suggestions, give them to Tiff. All right.
Well, I just, we'll find the money, put 8.2 million into the other thing, put the other million here, because the property's still.
there you go.
Okay, Maury.
So this is a recommendation and it is going back to the Bennington facility. When you look at their feasibility study, their budget goes out 5 years. So I'm back to if, maybe $1 million out of the 9 million.
Which is what Art just said.
Oh, okay. It's my hearing in that side, so that was good.
Okay, so everyone in favor of saying to Probst that the Satori House is still one of our priorities and should be in the one-time funding.
Oh, wow.
Is that everyone?
That's great.
You have that, Tiff?
I'm sure that.
I don't know what to expect. I'm always happy to do some chances.
What am I missing, everyone?
The cost sharing and the Medicaid, drugs.
the drug coverage changes with pharmacy benefit, yes. That we did not support.
I still don't support it. I still don't.
It's not, so it didn't get put back in the Senate budget?
No.
Okay, so is there a question?
I think Mari was
So
talking about what she wanted to
it
do.
went back to what the administration wanted, right?
Yes, which
So-
was taking those drugs away.
Yeah, and I don't want to do that. I
Okay,
think it's a slippery slope and we should be heading the other direction and covering
more drugs.
more drugs, not taking them away.
Okay. Does everyone know what we're talking about?
Well, I'm just confused because I thought that it was in the governor's recommend.
To take it out.
To take it out, but the House and the Senate said, we don't agree with that.
No.
So that's what I'm confused about.
So we put it in our budget that we did not agree with the governor.
That's
we
right.
should, and the House agreed with the governor.
The Senate?
The Senate.
The House agreed.
Oh.
According to Sarah, the House agreed with the governor and then the Senate did as well.
Okay, that's confusing.
Well, it's not my area.
I know. Oh, that's okay. And
I can't.
and I don't think that's the issue right now. I think the issue is it is
Such a
out,
small-
right?
I am not, I will go back to my notes.
That's fine.
Section.
So it is the governor's recommend is currently in the budget as passed by the Senate that these 3 drugs will no longer be covered. And I remember it was the antihistamine and the melatonin and vitamin D.
And I agree with Maury. That's all I'm saying.
It just sends a huge message.
Yeah.
It's a small amount, but it
charge?
sends a huge message.
Okay, so it's,
The
I'm
message,
gonna add,
the message is get rid of them, you mean that should start a lot.
The state government is pulling support away from medications that people need.
and remember we heard that if they don't get it here, they might move over to prescriptions, which would cost us even more, is what we heard, or they would go without, which maybe down the line would cost even more because now they're going to the hospital for whatever. So I'm gonna ask 2 questions. The first is going to be, who wants to put forth that we do not agree with the governor's recommend and we do not take away these 3? That's our first decision point, these 3 drugs. All in favor? 1, 2, 3, 4, 5, 6, 7, 8, 9. How many people are there?
I forgot you.
No, I'm not voting for it. Okay, so still a majority, so 9 to 2. Tiff?
Yep.
And then I am gonna make us prioritize Soteria House over this, or vice versa. So we have number 1 and number 2. One is Soteria House, and 1 is these 3 drugs.
Okay.
Which one is a higher priority for us to cover?
I feel like King Solomon.
I'm not doing it. Yeah, I'm not doing it. I can't.
Well, Victoria House for me.
Okay, everyone in favor of Soteria House is number 1. 1, 2, 3, 4. I can't count. 1, 2, 3, 4, 5, 6, 7. Okay. The other one? We're not voting.
Oh,
You're the drugs?
we cannot vote?
No, I would like everyone to vote. I mean, this is our job,
Yeah.
quite frankly.
But it,
Tough choice.
It's
But it's a
my
binary.
job.
Yeah, life is not, it's
So
a
advocate.
zero-sum game, it's stupid, whatever.
can I cast a vote for each? Can I say yes to, well, you said who supports this one, and so can I say yes, yes?
Okay, so 7 of us said Soteria House, so Soteria House is first.
I think that's clear. Because if we all are abstaining or refusing to engage in the process, you have a majority saying yes to that, so whatever. Like the straw poll anyway. The wind is breaking
So-
the straw right now.
I think that's everything. I appreciate that. I will write something up to make sure that we're all on the same page. And putting forth the same thing for appropriations. And then basically what we can do now, if you're interested, is follow the conference. So you can go on the webpage and find out when they're meeting.
Tomorrow.
They're starting tomorrow? Okay.
And members of our community will be watching, so we can we'll let you know
Yep.
if there are things that come up and any questions.
Okay.
The committee should.
Who are the members on that?
So there are, the 3 House members are Diane Lanfer and Robin Scheid and Teresa Wood.
Okay, those are the ones, that's,
Can we just sum up, because I got lost in the whole conversation.
Okay, one meeting,
And Diane.
one meeting, everyone.
So the language, basically the Senate stripped out all the language that we had put in.
No.
No? What did they keep?
So they kept the sunset.
Okay, they kept the sunset. They did not keep the hospital transformation. They did not.
The
or they
hospital
changed the study.
transformation is going into 206.
Okay, the study.
The
they
EMS they changed, which we're comfortable with. We're just gonna add back in the consultant.
The blueprint for health payments to providers.
That I think is going into 206.
Okay, and then the increase in the Medicaid dental cap.
They're doing, and then we're gonna put forth Mike Fisher's healthcare advocates language to
Okay.
their language.
Okay, I just want to make sure everything's
Yes.
going somewhere.
Yeah, everything's going somewhere.
So for those of us who want to follow along, if you go on our website, go to committee types and go down to the committees of conference, that's how you can find the joint conference.
Okay, we're gonna go off air. Thank you.